Okay, stage party can be seated. I got the spotlight on up here. I can't see y'all. Okay, perhaps if we could turn the spots down a touch and maybe turn the house lights up just a touch. And as we're doing that, just a reminder, I know you've gotten the reminder already before we started here, but because we don't know who in the audience may be at higher risk or vaccine status, et cetera, we'd like to have everyone wear masks. If you need a mask, we have some out in the back area there. Okay. Welcome, everyone. It is wonderful to have you here. It is wonderful to be able to do a white coat, albeit a little bit delayed for the class of 2025. I'm Dr. Bob Trombley. I'm the dean here at ATSU-ASDOH, or the Arizona School of Dentistry and Oral Health. I'd like to begin our ceremony today to honor America. I ask that you please stand for our national anthem, and today it will be sung by Dr. Mai-Li Duong, Associate Professor, and one of our ASDOH alum from the class of 2012.
Oh, say can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the
Thank you, Dr. Duong. Unfortunately, Dr. George Blue Spruce, our Assistant Dean for American Indian Affairs and Assistant Professor here at ASDOH, is unable to attend today's ceremony due to personal reasons to give the blessing for the white coat ceremony. However, we were able to pre-record his blessing for our white coat ceremony. We're so proud to have Dr. Blue Spruce as part of our faculty since the founding of ASDOH. He is not only the first American Indian dentist to graduate from a U.S. dental school, he's also served as our nation's Assistant Surgeon General. He continues to inspire new generations of American Indians to pursue a career in dentistry. Please turn your attention to the screen for Dr. Blue Spruce's blessing.
I'm a full-blood member of the Pueblo tribe of New Mexico, and there's 19 villages that make up the Pueblo tribe, and I come from 2 of those villages in terms of my dad and my mother, and there's 4 dialects that are spoken among the Pueblo people, and my invocation is going to be in the dialect of my mother. That's the Tewa dialect of the Pueblo language. Sangi Samu, Novitawa Imui, Hichungadi Opoa, Kunta Woha, Okeawangi, Kuishti, Naimbe Sendo Yosi Tala, Dintoyan, Umbi Eandimu, Din Fewana Ne Sawandita, Din Fewana Ne Wangi, Din Fewana Ne Kogi, Din Fewana Ne Iwandi Toan, Kunta Woha Naimbe, Kunta Wawatsi, Kunta Naimbe, Kunta Eka, Kunta Wawatsi, Sangareho and Mui. Amen.
Now I'd like to introduce the stage party. On my right in the first row is Dr. Craig Phelps, president of A.T. Still University. Next, Dr. Norman Gevitz, senior vice president, academic affairs. Dr. Fred Olson, president of the Arizona Dental Association, and Dr. Joseph Creech Jr., ASDOH faculty member, director of pediatric dentistry, and today representing the American College of Dentists. On my left in the first row, Dr. Wayne Cottom, our vice dean, Dr. Lindsay Springer, an assistant dean and director of Comprehensive Care Unit 1, who today will be our keynote speaker. Dr. Jeffrey Parent, associate dean, patient care and clinic education, as well as chair of our ASDOH admissions committee. Dr. Rachel Duffy, an assistant professor and clinical faculty member in Comprehensive Care Unit 2, and Dr. Fred Ruaco, assistant professor and director of Comprehensive Care Unit 2. In the second row, starting from my right, Dr. Mindy Motahari, assistant dean and director of interprofessional education, Dr. Janet Walt, associate dean for academic assessment, Dr. Seena Patel, associate professor and director of oral medicine, and Dr. Mai Li Duong, associate professor and assistant director for our special care clinic. On my left, Dr. Irv Silverstein, ASDOH adjunct faculty member and pre-dental advisor at the University of California, San Diego. Dr. Donna Silverstein, also ASDOH adjunct faculty member and pre-dental advisor at the University of California, San Diego. Dr. Claude Rizuki, associate dean for preclinical education. Ms. Kimberly Lovell, faculty clinical instructor and faculty member for our predoctoral dental program. Dr. Jermaine Hendon, director of dental education and student success. And Eli Kutzall, president of the class of 2022. Thank you for joining us. Okay, I can't see you all very well, but I know you're there. Hello, class of 2025. And hello. And welcome to all our guests. I'm privileged and honored to be standing here as Dean of the A.T. Still University Arizona School of Dentistry and Oral Health, representing our faculty, staff, students, and residents. Today is a very special moment for our school, as well as for the class of 2025, who is now just beginning and a little further along than usual at this point with the white coat ceremony in their first year as they move towards a place in our profession. Since I've become dean here at ASDOH, I've shared this brief quote at all our white coat ceremonies, as well as at our commencement. So if you pay close attention, you'll hear it again in about 4 years, okay? It's from a Persian Islamic poet, Rumi. It's your road, and yours alone. Others may walk with you, but no one can walk it for you. So I share this for a couple of different reasons. First, it's your road and yours alone. You've each walked along, traveled along a unique path to get you to where you are today. And it included successes and failures. But you're here today after our admissions committee looked at over 2,500 applications. Because somewhere in there, the faculty recognized a couple things. And I don't know specifically what it is in your unique path, but what I do know is that you've accomplished much. And I do know, because this is what our mission is here, that somewhere along that path, you've been able to demonstrate compassion and caring for others. When you get your white coat today, that's going to be an acknowledgement of your path and your compassion and caring for others, what you've done to get here and what you will be doing after graduation. Now, second, others have walked with you. And we all know that we owe much to those who walk with us, our friends, our family, the mentors. So what I'd like to do for just a few moments is to have you reflect a little bit on those who have walked with you. Now what I'd like you to do is stand up and give a shout out to those who happen to be able to come with you today, and give them a big hand for all the help and support that they've done. Go ahead and stand up, class of 2025. Turn around and give a shout out. All right. Now they know where you're at and stuff too, and you kind of locate each other, so. All right. So yesterday, Dr. Cottom, Dr. Wolt, and myself spent a little time with the class of 2025, and we talked a little bit about the oath and some other things, and I'd like to share just a few things that we talked about over Zoom, which is one of our modes these days. And that's a little bit about the white coat history. First off, white coats have not always been a part of the health provider, the doctors, the physicians, the dentists, the allied health providers in terms of what they wore and what they represent. If we go back into the 19th century, into the 1800s, and if you think about some of the movies or paintings that you may have seen, oftentimes the physicians and the dentists of the day wore a black suit, a very formal black suit, not a white coat. And there were a couple of reasons for wearing that black suit. One of them was that, quite honestly, physicians and dentists were kind of a last resort. A lot of what the healthcare providers in that day did was very somber, formal, because people really didn't get a whole lot of benefit out of working with physicians in that era. There was another kind of practical reason as well. The black coats kind of hid a lot of the dirt and stains that came with treating patients in that era. But as the 19th century wore on, we get into the 1880s, 1890s, asepsis, the scientific method began to be taught in medical and dental schools. And there was a shift from the black coat and the somber to the white coat, representing not only cleanliness and the asepsis, but also to separate those who were trained in the scientific method from those who were still perhaps doing more questionable procedures of the day. The white coat ceremony itself didn't actually start until 1993. And the first white coat was Dr. Arnold Gold, who was at Columbia University's medical school. And by the end of the 90s, virtually every medical, dental, allied health programs had incorporated the white coat ceremony as part of their program, whether it be at the beginning or somewhere within the medical education program. The white coat represents a lot of different things, to those, our patients today and those around us today. It's not just about cleanliness and the scientific method. The white coat now, for some of our patients, can represent power or authority, absolute knowledge, fear, discomfort. And that's going to be a challenge to you. And that fear and discomfort actually has a name some of you may be familiar with, the white coat syndrome. But to most of our patients, and your challenge for those patients who have the fear and discomfort, is to make that white coat a symbol of the hope and the opportunity to be an equal partner in managing the health of your patients and your communities. So today, as you put on the white coat, it's going to represent your acceptance of a social contract with your patients and your communities and your profession. And we talked about some of those things in the oath and some of those values: honesty, integrity, trust, responsibility, respect, compassion. Or, as you've heard us say before, your obligation is to do the right thing, even when no one is watching. So a question often comes up as we start the class with their white coat is, now that I got my white coat, when do I get to wear it? Well, my answer to that is, from this point forward, you'll always be wearing your white coat. Each and every day, every interaction that you have with your classmates, your patients, with someone in your community, you'll be representing not only yourself, but your school, your peers, your profession. And there's one more reminder that I wanted to share with you before I share the podium with a few others here today. And you've heard this since you arrived at ASDOH. If it hasn't already, the competition ends today. You're here because you've demonstrated that caring and compassion for others. That includes making sure that you're there collaborating and working with your classmates, the faculty and the staff, your communities, to make them the best that they can be. You're not here just to learn, you're here to teach. And if you work together, you will certainly exceed all of your expectations. Welcome to the ATSU-ASDOH family. First, I'd like to welcome Dr. Norman Gevitz, Senior Vice President, Academic Affairs of AT University, to say a few words. Dr. Gevitz.
The world's first dental college was established in Baltimore, Maryland in 1840. Its graduates received the DDS, or Doctor of Dental Surgery degree. Prior to the creation of this school, all college-educated graduate dental practitioners in Europe and the United States held the MD degree or its equivalent. In 1867, Harvard University established its dental college side by side with its medical school, and many dental students stayed at Harvard to attend and graduate from both colleges. Instead of a DDS degree, Harvard awarded a Doctor of Dental Medicine degree, or DMD, to signify that its graduates were trained as physicians of the oral cavity and its adjacent structures. The DMD is a degree that ASDOH will award you when you complete your curricular requirements. As the 20th century unfolded, American medical schools and dental schools lengthened their undergraduate curriculum, and consequently, the desirability of attending and graduating from both schools and attending 2 separate degrees diminished. The ensuing professional separation of medicine from dentistry has raised questions about the domains and divisions of knowledge and comparative scope of practice regarding the oral cavity and its adjacent tissues. Where are the overlaps and divisions between the dental and medical practitioners? What challenges are there in defining and delineating scope of knowledge, scope of practice, and licensure? Which practitioner is competent to do what? Most importantly, how do all these questions impact access to, the quality, and the cost of patient care? In the United States, most professional schools have established artificial knowledge and training silos that do not encourage the broadest possible learning. However, at ATSU, we are dedicated to producing a cadre of broadly trained healthcare practitioners. We, as healthcare educators, need to ask, what should our osteopathic medicine, dental, and physician assistant students know about and be prepared to manage individually and especially as a team the diseases and dysfunctions associated with the oral cavity and its adjacent tissues? At ATSU, we love to innovate, and we can bring different healthcare practitioners together in our state-of-the-art simulation labs, in joint teaching, and team-based problem solving, both here and in community health centers, to enrich you, your DO, and PA student counterparts to produce distinctive, collaboration-ready practitioners. To date, ASDOH and ATSU have received 2 federal grants which allow dental, medical, and PA students to train together in community health centers. Your white coat is not only representative of the beginning of your professional journey, but ATSU's commitment to educate the most broadly prepared and qualified graduates in the healing arts. You have entrusted yourselves to us, and ATSU is surely committed to you. Thank you.
Thank you, Dr. Gevitz. I would now like to welcome Eli Kutzall, President of the Class of 2022, to say a few words on behalf of the ASDOH student body.
Class of 2025, you guys have made it. Take a deep breath, right? You made it through high school, you made it through undergrad, you made it through organic chemistry labs, you made it through the DAT, and now you've made it through the first half of your semester of dental school. Are you guys proud of yourselves? If you're anything like me, you imagined the day that you would receive your acceptance into the profession of your dreams. A well-respected but oftentimes feared profession that leaves you capable of improving the oral health of every single individual that you come in contact with, not just in a dental office. You're gonna realize really quick, people are gonna reach out to you on Facebook. They're gonna start asking you about all the things that you're learning in dental school. They're gonna say, hey, can I FaceTime you and find out about the difference between a veneer and a crown? Should I get veneers, right? You guys are going to be the knowledge holders. You've made it to the place that you've dreamed about. You've shed tears over it. You'll undoubtedly remember and reflect upon all the lessons that you learn here throughout the rest of your careers. But your work is just beginning, okay? You'll be exposed to more knowledge in the next 4 years than you know what to do with. You'll hear the expression, it's like drinking out of a fire hose, and it is. For the next 4 years, and when you finally start to get a grasp on it, they kick you out the door. And then it's on you to continue to learn and to grow. You'll be held to a higher standard than many other professional students, but you will be better for it. You'll become a dentist capable of healing patients. The next 4 years are not easy. There will be days where you wonder if your hands are capable of the skills of dentistry. You all have first-hand experience now of being in sim clinic, working with a handpiece. It's not easy. And then one day, I hope what happened to me happens to you, where you're driving to school, listening to music, and you're just thinking about your day. And then you look at your hands, and you say, man, these hands are learning how to impact people. They're learning how to fix problems, to cure disease. And you didn't think you could hold a handpiece last year. I hope that you experience that, because that joy also comes with a weight of realizing that all the knowledge that you're being taught, it is crucial that you take hold of and that you master that knowledge, because you will go out into the world as dental practitioners in charge of your patient's health and charged with providing the best care possible. These next 4 years are incredible. I can promise you that. It goes by in a blink of an eye. And don't take it for granted. Enjoy every single moment while you're in dental school. Be the student that stays late. Be the student that's there answering all the questions you can for your classmates. Be the student that's willing to learn and ask questions. My mom calls me a type AAA individual. Because there's type A and then there's me, all right? It's hard to admit when you're wrong. You're going to make mistakes in your career. Make them now, and make as many of them now as you can. Admit when you don't know something, because somebody else in the room has the answer. And when you admit that you don't know the answer, that is when growth happens. Many of you guys know a song by Owl City called Fireflies, okay? And I say that just for context, all right? He was one of my favorite artists growing up, but he has a song on one of his newer albums, still very old, and it's called The Verge. And he talks about how the verge is something exciting. It's the unknown. You've experienced your life up to this point, and now you're on the verge of something great. And all you have to do is not be afraid to jump into it. Welcome to dental school, class of 2025.
Well said, Eli. You can tell the future is in good hands here. And I can relate to the fact that if you haven't had it happen already at Thanksgiving, Uncle Joe's going to come up and say, I got this tooth here. Okay, speaking of Uncle Joe, I'd now like to welcome Dr. Joe Creech, our Director of Pediatric Dentistry, who's going to say a few words on behalf of the American College of Dentists. Dr. Creech.
Well, good morning, 2025. You guys are obviously the VIPs today, but having been where you are years ago, I want to recognize those VIPs out there, because there's no way these guys would be here if they didn't have you there, right behind them. So today I'm here on behalf of the American College of Dentists. The American College is the oldest national honorary organization for dentists. Its mission is to advance excellence, ethics, professionalism, and leadership in dentistry. Membership in the college is by invitation and acknowledges these qualities in their members' professional careers. As the newest members of our profession, you're now tasked with upholding these same principles. So now, it's your turn. It's your turn to begin to learn the fundamentals that support everything we do. It's your turn to start developing the surgical skills that will allow you to provide excellent care for your patients. And your ability to provide this excellent care will not be based on just what you learn over the next 4 years, but what you learn throughout your career. Your education must be a lifelong process. Now it's your turn to become the professional that this white coat represents. This coat is the outward badge that symbolizes you're no longer simply a classroom student, but a member of a select group of professionals. And your actions must reflect positively not only on yourself, but also on all of us. Now it's your turn to become the leader that all doctors must be. You'll, of course, lead the care of each patient and each family you see, but your leadership must extend far beyond the walls of our clinic and eventually beyond the walls of your office. Your leadership must be part of your community and all you meet there. Your leadership must be part of every conversation, every action. Now it's your turn to demonstrate your understanding of ethical behavior and what would become ethical care of the patient in your hands. The role of the college is taken in promoting excellence, professionalism, leadership, and ethics, has suggested that it represents the conscience of dentistry. Now, you all know conscience. That's that voice we all hear in our heads or in our hearts that tell us something is right or wrong. It's what guides us through life. It's what makes us human. It absolutely is what will make you the doctor you should be. So now it's your turn to begin this journey and exercise your own conscience of dentistry. Embrace the journey. Now it's your turn.
I apologize. Where's Dr. Olson? We did invite you here for a reason. I got so excited about Uncle Joe, I just skipped right ahead. I'd like to introduce Dr. Fred Olson, who's currently the president of the Arizona Dental Association, who will share a few words.
Thank you very much, Dr. Trombley. Hi, my name's Fred Olson, and I'm a retired general dentist who practiced for 36 years, you young folks. That's a long time. But I'm currently the president of the State Dental Association, also known as ASDOH, which is part of the American Dental Association, or ADA. Dr. Trombley mentioned the attributes that a lot of you have. Well, the ADA has a code of ethics, and if you can follow those, you will be very successful throughout your career. I'm here today to talk to you about the value of organized dentistry. You guys are well represented here with your staff and faculty, with people that represent the ADA, the state, the House of Delegates, everything like that. You've got a lot of knowledge from your faculty, which is great. They've recognized the importance of what you are about to become and what you need to stay active in, and that's the Dental Association. During my many years, the ADA and the State Dental Association was able to help me out, and there's too many things to say going back to the 80s that they've done, but the last couple of years have been very challenging, and what they have been able to do at the ADA level, the state level, and the local association as well. We've been able to keep COVID kind of in check from the business side of things and from what you are able to do in school. We were able to get PPE and PPP loans to keep dental offices open. They really stepped up at the Chicago at the ADA, and Dr. Dan Clemenson, an oral surgeon, recently, as of last week or 2 weeks ago, is no longer the ADA president, but he was president, and those guys had to work big miracles. You know, they got dentistry with labeled as an essential provider. They were able to keep offices open, and for those of you that may go into private practice right away, the debt load is not forgiving. So there was a lot of money, a lot of offices could have closed without that guidance and help of the ADA. That's key. That's the last couple of years have been very challenging. The other things that we've been able to do at the local level, BODEX, which is the state dental board, which you will hopefully never become familiar with, but you'll have to get your license through them. We were able to decrease the licensing fee. That's pretty big. Recently, it's still $200, but a couple years ago, we actually got it down to zero. So it's things like that. The state politicians, we have to lobby. Unfortunately, you have to be involved politically, or you're going to be told what to do and not necessarily do the right thing. I can tell you that as we adapt to the new normal, we need all of you to become involved. Organized dentistry, advocacy is the #1 priority of a lot of the members, you know, through these polls and everything. If you don't have advocates on your behalf, you're going to be on the dinner table instead of at the dinner table. It's important that you become involved. What else is there that we can really share with you? It's continuing education once you graduate. That's important. We at the state level were able to negotiate nitrile gloves. You know, there's a shortage of sterilization things, but we kept at it, kept on it, and were able to gather some of that for a reasonable fee, not $10 per mask, but $1.50 per mask, things like that. In the end, it's the ADA, the ASDA, and Central Arizona Dental Society, or Southern or Northern, they're us. It's made up of us. We are all dentists. That's the bottom line. And if you get involved as a student, which you guys are represented, thanks to Dr. Tromley, become involved, learn about it. Heck, when I was in school, I struggled just getting up in the morning, let alone knowing what all these different things were. But become involved. You've got many faculty, like I said, that are involved. But the involvement is crucial. And again, I'd like to thank all of your close friends, relatives that have helped you get to where you are right now. From now on, you're moving ahead no matter what your life's goals are. But thank you very much, and thank you, Dean Tromley.
Thank you, Dr. Olson. Really appreciate all that you've done on behalf of the profession and working with the Arizona Dental Association. I'd now like to introduce our keynote speaker for today, and it's someone that you will get to know very well in our clinics. It's Dr. Lindsay Springer. She's the director of one of our comprehensive care units, #1. She graduated from University of California, San Diego with a bachelor's degree, and then she received her master's degree in advanced studies in leadership of healthcare organizations at the University of California, San Diego as well. She received her Doctor of Dental Medicine degree from ASDOH in 2012, along with her master's in public health with a dental emphasis. Upon graduating from ASDOH, Dr. Springer served in the United States Navy as a dental officer from 2012 to 2017. There, she completed an advanced education in general dentistry certificate program at Camp Pendleton. She completed a humanitarian deployment to Vavaudanga. Did I get that? All right, in 2014. And then upon completing her tour on the Marine Corps base at Pendleton in 2015, Dr. Springer was assigned to the Marine Corps Air Station at Yuma, Arizona. She completed another humanitarian deployment on the naval ship Mercy, a hospital ship in 2016, which went to Southeast Asia. Dr. Springer was honorably discharged from the Navy in September 2017, and shortly thereafter joined ASDOH as a faculty member in 2017, in October. She has truly a passion for service. She's been active here in the Phoenix Junior League since 2018. She loves spending time with her husband, 2 daughters, and their dog. Dr. Springer, welcome.
Welcome to our family, your new ASDOH family. You gained lots of new extended family members when you walked into campus this past July. You may have noticed some of us are alumni. Some have practiced in the profession for over 40 years. Some have practiced mostly in academia. Some have served in the military. Others have practiced in community healthcare centers. A few have jumped out of clinical academia into administrative academia. Hi, Dr. Tromley. One thing that we all have in common is that we want to be here to help you through your journey into the dental profession. Congratulations on all the hard work and sacrifices you have made to get yourselves here. Thank you to your families and friends for supporting you along the way, and for those who will continue to support you throughout your dental education. I can tell you the road is not always easy. Your stress level will be high at times. There will be late nights studying for exams, stressful courses, testing your newly developed hand skills in the simulation clinic, course requirements that just don't make sense at the time, the mounting pressure of boards that are right around the corner, the stress of giving your first dental injection. The first time you pulp a tooth is still looming. The nervousness you experience right before you extract your first tooth. The excitement of selecting external rotations, and then the semantics of figuring out how to be away from home. The good news is there's 78 new friends to help you through all of this. Be kind to one another. Support one another through this journey. If you haven't figured it out already, and it's been said many times today, the competition is over. It's time to work together. The goal is to have everyone graduate. Some of you will rock it in your didactic courses, and others will kill it in sim. They're going to be the unicorns in your class whose hand skills surpass everyone's. You all have strengths and weaknesses that you will see during your dental education. Accept each other's differences. Bring the diverse group that you are together as a common goal of helping one another. Share those fun facts about yourself. Get to know one another. Have fun. This will take you through those tough and stressful times and make it easier. Who knows, you may even meet your spouse. It happens in every class. It was almost 10 years ago that I was sitting in your place. I still remember how emotional my white coat ceremony was. It marked the beginning of a career that I had dreamed about since 7th grade. It signified that I had made it. I literally walked into the door of my #1 dental school. I also made one of the biggest decisions of my life. I swore into the United States Navy for the next 8 years. You wouldn't believe the amount of paperwork with that decision. I was just as proud and excited as you are right now. I was also nervous about what the next 4 years would bring, and as you already know, at ASDOH, you blink and you've had your first experience in the dental clinic as a D1. Before you know it, you're a D2, seeing your first patient in clinic. Then it's time to begin external rotations at the end of your D3 year. You blink again, and it's time to take your integrated board, and your licensure exam. And then boom, it's time to graduate. It may not feel like it now, but it goes by very, very fast. My best piece of advice is to always do your best. Even when you're tired, the curriculum does not seem to make sense, or you have a not so nice patient in your chair that is terrified of seeing you just as much as you are terrified of seeing them. That's all we can ask as educators and colleagues, to do your best. We are here to help you in any way we can. You are responsible for understanding and retaining the information. We will supply you with the knowledge that you need for a great dental school education. You have chosen an amazing profession. We are patient-centered with a long history of service, and we are always in demand. Healthcare awareness has been heightened by the pandemic. People are becoming more and more aware that oral health is directly linked to overall health. Integrated health relationships between dentistry and medicine continue to grow stronger and stronger. ATSU strives to strengthen these interprofessional relationships, as you will see throughout your education at ASDOH. When you graduate, you will be equipped with the tools to aid in providing whole-person health care. We are no longer a drill and fill profession. Technological advancements continue to bring about rapid changes in our practice of dentistry. You will experience 3D impression making to fabricate crowns and dentures. You will have 3D printed diagnostic casts for your treatment planning workups. Artificial intelligence will likely make an appearance during your careers. Regardless of all these technological advances, we will likely continue to battle the most infectious disease known to humans, caries. Historically, our profession has focused on surgical interventions. However, we are making great progress in prevention and using non-surgical treatment overall. I know you're excited to prepare your first tooth, or perform your first extraction, or your first pulpectomy, but I urge you to be equally excited about less invasive options like silver diamine fluoride, vital pulp therapy, and good old-fashioned patient education about hygiene habits and diet modifications. Question the etiology of the disease or condition. Know the risk factors as well as the protective factors. Look for opportunities to improve your patient's knowledge about their oral health and help them take ownership of their overall health. Be a lifelong learner. Our profession changes rapidly. Lifelong learning is paramount to your success. So is continuous quality improvement in terms of diagnostic and clinical skills. ASDOH will provide you a strong foundational knowledge and clinical skill set. But this is only a teeny part of what you need to be a competent practitioner. Continue to evolve. Your patients are counting on you to provide the best care possible. Judge your success not on monetary value, but that you have the opportunity to see each and every patient that sits in your chair. They are trusting you. They want your skill set and your expertise. Hold yourself to the highest ethical standards. Do no harm. You are all capable of a long and successful career in dentistry. I challenge you to go out and get involved. Become a leader not only in dentistry, but in your community. Be generous with your time and your skill set. Mahatma Gandhi once said, "The best way to find yourself is to lose yourself in the service of others." You are our future, and you will continue to shape our profession. As you journey into your D1 year and beyond graduation, you will come to realize that ASDOH is special for many reasons. One of my personal favorites is our faculty support beyond the lecture room and beyond the dental clinic. We are a phone call, text message, or email away. You will always be part of our ASDOH family here, now, and beyond your graduation date in 3 years, 6 months, and 11 days. Welcome to our family.
Thank you, Dr. Springer, and thank you to all who have shared your thoughts with the class of 2025. Let's give a hand for all the speakers. Now, the main event. It is the presentation of the white coats. And for the class of 2025, here we go. I'll be assisted by Dr. Jeffrey Parent, Dr. Rachel Duffy, and Dr. Fred Ruaco. And we will get to our positions at this point in time. Anyone who's doing the lights for us, if we could get just a touch more light up in the front so we don't have somebody join the front row as they walk across unintentionally.
Is this on? Okay. You can see who the least important person is on stage because they gave me the toughest job. So I'm going to apologize in advance if I mispronounce your name. Chabali Abraham. Kiana Armenian. Anika Aurelia. Jordan Andrade. Elaine Ann Arshaga. Lance Atik. Brett Babel. Derek Bodden. Laura Betanker. Andrew Blazo. Brielle Breland. Briar Brooks. Morris Bowie. Tara Dadafarine. Mojin Danielle Kashmari. Keelan Dietrich. Donna Elshire. What? Sean S. Smiley. Rami Fatul. Allison Fedler. Kimia Ferruzzi. Philip Fromm. Nicholas Gagliano. Austin G. Samantha Gonzalez. Anna Gunter. Maria Gani. Oh, okay, all right. Delana Ha. Shirza Haroon. Shahriyar Hassan. Keenan Henscheid. Mario Abraham. Diane Jung. Okay. Abdul Kadir Kalo. Kirpa Kachar. Paulina Crestone. Hannah Lee. Shelley Lee. Kelly Lidehold. Shireen Linebeck. Paige Lanier. Amber Lust. Mohamed Mabuda. Dimitri Mahi. Deanna Mahmoudi. Amanda Marshall. Christian McSweeney. McKinley Minor. Sam Marceriti Farhani. Christian Mulcahy. Megan Neal. Ruby Nguyen. Cayman Nielsen. Jordan Nolan. Kiana Okanowski. Anna Panfil. Mariam Rashid. Jonathan Roy. Samira Shaduji. Puya Sarafzadeh. Shana Shapras. Nathan Sherman. Daniel Shin. Ryan Ship. Michael Simon. Timur Shushitsky. Michael Swan. Tina Tasherard. Mario Toma. Kiram Tung. Zachary Werner. Nicole Vian. Yusra Vora. Dominique Yellowhair. Janelle Yosef. Monica Youssef. Neha Safar. Maria Flowinska.
All right, well done. We didn't lose anyone off the stage or anything. Okay, next, we have the oath to the profession. Dr. Sina Patel, Associate Professor and Director of Oral Medicine at ASDOH and an alumni member of the class of 2010. She will administer the oath to the profession. Dr. Patel. I don't know, somewhere.
Thank you, Dr. Trombley, and good morning to the class of 2025 and respective guests, family members. And I'm really lucky to be here, especially with my esteemed colleagues and faculty up here on stage. I'm truly honored to be able to give this oath to this wonderful profession to you all today. This oath lays the foundation for the work that we do every day to care for our patients righteously. With that, I ask the class of 2025 to please stand. Please raise your right hand and read this oath along with me. I pledge to faithfully fulfill my obligations as a member of the dental profession. My responsibility is to promote the health of the community and the persons I serve. The health of my patients will be my first commitment. My practice depends upon the trust of my patients. I will not violate that trust. I will do no harm. I will honor my peers. I will respect the diversity they bring to the profession and commit to our mutual success. I will honor my patients' dignity. I will be their zealous advocate, sensitive to their feelings, needs, and thoughts. I will not discriminate against any person in my decisions and care. I recognize the limits of my competence. I will seek knowledge and inspiration from my colleagues whenever my patients' needs require. I will strive to improve my knowledge and skills. I am responsible for contributing to the improvement of the community. I will strive to prevent disease and correct adverse social conditions. I will serve as both a teacher and role model for my patients, my successors, and the public. I am responsible for upholding my profession's integrity. I will strive to counsel those deficient in character or competence and expose those who engage in fraud or deception. I will use my professional knowledge according to the laws of humanity. With this oath, I willingly assume these responsibilities. Thank you. You may now sit. Congratulations.
You may be seated. I'd now like to introduce our president, Dr. Craig Phelps.
Thank you. Well, I love that oath. I hope someday that you'll have a copy of that, place it on your wall in your waiting room, so those patients and their families and others that come in, read that, they're going to say, I want a dentist like that. I want a healthcare professional like that. So Dr. Trombley, congratulations, and thanks to all those who spoke. Dr. Springer, it's always great to hear from our grads, and what a list of accomplishments. And what you said, it's only been 10 or 11 years since you were, oh my gosh, fantastic. Thanks to our student affairs, our communication and marketing folks, and to the staff at ASDOH for putting on a great white coat this morning. So I want to give them a nice round of applause. And students and families, you're lucky. The ASDOH faculty and staff are amazing. They are just the most caring, most competent group of folks that you can be associated with. And as was said earlier, this is a lifetime commitment. You're going to be working with them for many, many years in the future. There'll be that tough case. You're going to call them up and say, hey, what do I do? And then vice versa, they're going to, hey, we need an alumni to serve on this board, and they're going to call you up. So it's the beginning of a great long-term relationship. And then amongst you, I think in many ways, I communicate with my class of my medical school graduating class more than with my undergraduate class that I graduated with. And it seems weird now because it's been a different time perspective for you. But when I look back on it, some of the deeper friendships and lifelong friendships and knowing families back and forth and what's going on really happens with the group that you spend some of these next 4 years with. But congratulations, students and families. The white coat, you heard about it. It's important. It symbolizes a psychological contract between you and your patients, once again in that oath that will last a lifetime. Patients will be sharing their intimate details with you and your healthcare team. Patients will allow their children, spouses, sons, daughters, parents, and themselves to be exposed to an inexperienced student in order to educate you for the benefit of humankind. No other profession allows this. Talk about that high-speed drill in the mouth of one of your children being treated by a dental student. I've gone to the ASDOH clinic and have had my dental care done, and the students do a wonderful job. Your priority is to always act in the best interest of your patient, no matter their political beliefs, race, gender, preferences, income, age, education, or status in life. When there's pandemonium about, and there will be, Pause and ask your team, what is best for our patient? Collectively, you and your team, with the support of internal and external resources, can take care of just about anything and anyone who comes your way. It just takes a leader in a white coat to make it happen. Someone with a deep abscess or infection, someone who may have family issues, perhaps a recent suicide in the family, or perhaps a senior citizen who comes to you that recently lost a spouse and is just there in some ways to be able to spend some time with you and your team. These are the things, the highs and lows that you'll be associated with that will last a lifetime and will build upon your profession. Please keep your original white coat. When this job is done, hang it in your closet or office. You'll probably want to get it washed or dry clean to remind you of why you chose to dedicate your life to the health and wellness of others. The coat will continue to remind you of your grateful patients, your family and friends, faculty and staff who help you along life's way. Put that program in there. It has the oath. It has a list of all your classmates, right? So when you're like really, really old and you forget, you can look on there and say, oh, I remember them. And it also has a list of the folks who supported you today in your white coats. So take that, hang it up, and it kind of reminds you of why you decided, hey, I'm really interested in helping dentists and really helping others and really interested in oral health. Dr. Trombley and faculty and staff, thank you for inviting me to share in this special day with you. You heard earlier, I think we have 42 months till we meet again at graduation. All right, let's get busy. Congratulations, thank you, until we meet again.
Thank you, Dr. Phelps. And again, I want to add my thanks to all the staff at ASDOH and at ATSU for helping make this possible. And I know we've had to be patient given this little pandemic thing and had to put it off a few months, but I'm glad we were able to do it in a reasonable period of time and to be able to share it with a reasonable group of our friends and family and loved ones. So thank you all for coming today. I know it means a great deal to the class of 2025 as they continue on with their professional journey. Class of 2025, it is an honor to have you join ASDOH. We are so happy to have you. I hope you all have a wonderful weekend. Let's give a big round of applause for the class of 2025. I hope you don't have too much to study for over the weekend, but you know, this happens. All right, have a wonderful weekend, everyone. Let's see if I have any other announcements I'm supposed to make. I'm going off script, okay. Are we gonna have a picture somewhere? No. Okay, we're gonna get a picture another time. All right. Congratulations again, everyone. Have a wonderful day.